never had blood work done. I've been bodybuilding and eating everything, taking everything to get as big as possible. I would just look at the mirror and Google search any type of symptoms or side effects, and it was just like Dr. Google for so many years. I didn't know what feeling good felt like because I never felt good before.
I like to help people. And I think that having a better quality of life is something that everybody would want out there.
Proved every single person wrong that we were going to fail.
I've consistently been very healthy and kept the weight off.
I feel a lot better. My blood pressure's lower and everything's just clicking now. It makes more sense now.
Hey, hands down, it's because it's Titan Medical.
Welcome to Titan Medical Center, Vlad. We appreciate you coming down here and visiting us in beautiful Tampa, Florida. This is the experience that you would get as a normal patient when you walk in the doors through Titan Medical Center. You come into our beautiful lobby. At that point, you would be greeted here at the front desk. And then after you sign in, they're gonna give you, water if you like one, a t-shirt and bag, because that's how we roll when we're Greek. Wanna make sure we're giving gifts to our guests that are coming in here and showing them some love right off the bat. And then after that, you would be called pretty quickly. You're not gonna wait a long time at all to get serviced.
Hormone replacement therapy, HRT, TRT, testosterone replacement therapy, they all kind of go into the same bucket of, hormones, right? So men and females, they all have the same exact hormones. They have testosterone, progesterone, and estrogen. DHEA, they have prolactin levels. So all of these things, it goes hand in hand with both males and females. For males, they need more testosterone than females. And for females, we need a little bit more estrogen than males. However, it's all about a harmonic balance, and everything needs to be in a harmonic balance.
Basically what that means is if you get your blood work done, your testosterone's low, we try to get it to an optimal level by giving you testosterone. So if someone is, say, 200 and they should be 800, 900, what we do here at Titan is we just put them on some type of regimen. The medical provider gives them a certain amount of testosterone they would take every week, maybe twice a week, and then they get their levels checked again. And once everything is optimal, they just want to keep you right there.
I think at some point, a lot of people thought that you had to be a certain age to get on hormone replacement therapy, but come to find out, especially after years and years and years of doing this, that hormone imbalances is an epidemic. I mean, it's literally an epidemic in the entire world because of the deodorants that people are wearing, the laundry detergents, heating up your food in plastic. I mean, who would have thought heating up your food in plastic would have been a thing? So, just coming up on these things to find out that it's not just a certain age, or it's not just, hey, listen, I want to get big, and that's why you're going to take testosterone. No, it's the validity behind, any single age. I mean, you could be 25 and have a testosterone deficiency. I couldn't, honestly, I couldn't believe it. Hormone replacement, depending on where you're lacking or where you're at, whether you're postmenopausal and you need some estrogen because you're having hot flashes, night sweats, mood swings. Let's say you're a guy and you have low testosterone, you're in the same position, right? Oh, I can't get an erection in bed, or, I feel down about myself. I'm not as motivated. You go to the doctor, 9 out of 10 times, they'll give you an antidepressant and give you Viagra, send you on your way. And guess what that is? It's putting a Band-Aid on a bleeding wound. You're not actually fixing the problem. So when we started educating ourselves on all these different things, honestly, it was huge eye opener for me.
She told me I was crazy at first. She said, because she comes from Western medicine where if it's broke, we fix it. But we don't look at preventative or anti-aging things, right? Western doctors don't do that. And she, obviously, when I told her testosterone, she said, people are going to die, people are going to get heart attacks, strokes, just the myth that's out there and the stereotype. And I told her, I'm like, this is not true. I was like, if people are not being monitored, they're taking super physiological doses and doing these things like this, yes, they're going to be at a higher risk for some of these different things, and negative health things can happen to them. But if we're doing things right and properly, this is actually going to improve people's quality of life and their health. So, once I got her past that point and she really started doing some of the research and I showed it to her, then she was fully on board. And at that point, we just started driving forward at what we were going to do.
A TRT company or Titan Medical, what they do is they make people healthy, and they get people to really live the dream of life. It's one of those things I always say, do you want to live a long life or a quality of life? And that's what Titan Medical does. This is something doctors don't do, which I don't understand why that would be. But Titan Medical makes sure that you're healthy, really healthy. And then if there's a way that they can work with you to make you even more optimal and better, that's what they'll do.
Patient care and patient service is number one to us. The cutting edge therapies too as well. So as we walk down here, we'd walk into where our medical assistants would be. They're contacting patients all throughout the day, making sure patients are feeling good, looking good, and performing their best, making sure they're hitting their goals, making sure they're tolerating the medication properly, and everything is going well. So at that point, we're here and we're just basically making sure that our patients are getting the best service they possibly can. And if they have any questions, concerns, issues, that we're taking care of them too as well. We have everybody from average Joe to pro. So your housewife, right? Your guy that works the lawn, landscaping, your plumbers, and then you have your athletes. That could be a professional athlete, it could be an amateur athlete. You got your regular guys, you got a lot of executives. I mean, pretty much everybody across the board fits the demographic. So when somebody asks me, like, hey, what's your target demographic? I'm like, any male or female between 21 and 65 is our demographic, because we literally have something for everybody. Even if it's not hormone related and their hormones are great and everything like that, there's other things that people want to get benefits or results from, whether it's hair growth, nail growth. So we have that for females out there. Even the injectable vitamins and amino acids and stuff like that. This is something a 21-year-old can take advantage of, be able to really utilize these things, get a lot of benefits from it, know what they're getting and no fillers or anything like that, and feel better. So like I said, there's something for everybody. And when we start getting to Titan Medical Center, and we open that up, and we don't just specifically just go after one demographic per se. Like, I could probably just go after males and be very successful with just males, like I said in the beginning. But females play a big role with males. So, and at that point, there's a lot of relationships out there, and like that's when that could benefit even more, I guess, if they're both taking the therapies.
Titan Medical is different than other companies that I know of because of the fact that they first, and it's great, they want to make sure that you're doing everything you can do prior to them coming in and helping you optimize. So they don't let you skip out on just drinking water, eating healthy, getting enough sleep, just typical stuff your doctor should be trying to force you to do. Your husband or wife should be asking you to do. They stick on that. They go, hey, do these things, and these things are going to help you. And then what we can do is even help you that much more. And that's the ultimate thing. And then you as an individual will see such great responses to them and to what you're doing. You'll be a loyal, I guess, client forever compared to other companies. And this is the downfall. You have to be somewhat intelligent enough to understand some companies are going to upsell and try to get you on tons of stuff. And that's where I was before this. And that's why I was like, no, you guys are trying to make a buck. Because this is such a new thing and an amazing thing, there's companies out there that are going to try to take everything from you. Financial gain for them. Where Titan Medical's like, if I make a person healthy, they'll stay with us. And that's all we want to do. They want to change lives. They don't want to just fill their bank account, which is a nice thing in today's day and age where everybody's chasing the money.
When we started Titan Medical Center almost 12 years ago, people told us we're crazy, this was never going to work, nobody was going to inject themselves.
Yeah.
And then, this is what happened. I seen back then that there was going to be a big need for hormone replacement therapy and other things. Even when we started, hormone replacement therapy was really a taboo. It was just for bodybuilders, steroid guys, right, guys that want to get big. But it's more about health, testosterone receptors, cardiovascular health, feeling better, quality of life, having energy, having a good libido for your partner. These are all things that make up a good quality of life.
Yeah.
And we push, not just taking therapies, but the essential things: activity, sleep, water, nutrition. These are really, really key aspects that people need to master if they can, or get educated more about. So we like to push that too as well.
Yeah, I push the fact that if you're, 10 feet under, you're probably not going to look good.
Yeah.
So you have to be healthy in order to look good. So health is number one. And that's been the motto for 12 years.
Even more than the aesthetic purposes. We can get somebody that looks like a Ferrari on the outside and a Pinto engine on the inside.
Yeah.
So, we want
seen that.
It's from the inside out per se, right? I mean, aesthetics are great, but like I said, if that's only a short-term result that you have and now you're in a hospital bed or you're dying, it's just not something you want to do.
Was it really worth it?
So we like to push the education about that too, to make sure people understand these different things that could be going on with them.
The cool thing about this process now with TRT companies, and especially with Titan, takes 15 minutes. You go over, get your blood work done. Within a week or two, they get the results. And then a provider, one of their experts, calls you up and tells you what's looking good, what's not looking good. What are your options? What can you do? And you have a great discussion. It is so simple.
We have our consultation rooms. This is where patients would come in, they would get an IV, they would get any procedure that we could do. As far as injectables, vitamins, they can come in here, or they can do a telemedicine visit with us too as well. So if you want to come to our location, that's awesome. We encourage that. We love people coming down and seeing our facility. From online, that's one thing I've tried to capture in the media. I've had everything from drones flying through here and everything like that to try to show people listen, this is a real deal place. It's a multi-million-dollar state-of-the-art facility. So at that point, we want our patients to be able to come in here and enjoy it and get the best possible care and see what real service is about. But if you can't make it down, telemedicine, we can service you anywhere in the United States, right from here.
So I've actually been in nursing for 18 years. So when we opened the business, I implemented everything I've ever known. But this is a flag system. So this way we know, okay, for instance, if there's a provider in the room, I can literally step out of that room right there, look down the hallway and be like, okay, cool, there's a provider in there. Or if there's a patient, have them been waiting for a long time? Does the room need to be cleaned? Is there somebody need to be checked out? Is there somebody pulling the next patient up? So it's just a flag system to show what's what.
This is where our nurse practitioners are. We have two full-time, Chanel and Jess. So they get all their questions answered. They go over all their medical history. If they have blood, they go over all the full blood tests with them. And they educate them on a couple different therapies that might work for what they're trying to achieve as far as goal-wise. Mm-hmm. So they'll personalize the regimen to their blood work or their medical history along with that too as well.
Hey Drew, how you doing?
How are you?
Good, good. You ready to get your Titan complete?
Always ready, yeah.
All right.
Excited about it.
Remember what's in there?
I know it's B12. What else is in there, though?
Yeah, so not just B12. It has your full B complex. So 1, 2, 3, 5, 6, and 12. Also has your BCAAs, so those branched chain amino acids, and then L-carnitine and MEC, methionine, inositol, and choline. So kind of a little bit of everything there.
Nice.
All right, you ready?
I'm ready. Let's do
Perfect.
it. I've tried Hercules Potion. It's an injectable amino, it's a concoction of aminos that you would take. You inject it, spot inject it into the muscle before you train. That's one of my favorites before I work out. So if I'm doing shoulders, I just put one on my shoulder. And again, it's similar to people taking BCA powders. I mean, I see guys, I was the same way. I have so many different powders mixing up. I have heartburn. Now I'm trying to work out. It's making me use the bathroom. With Hercules Potion, I don't have that problem. So that's one of them. Serenity is something I took for sleeping. I had a lot of trouble sleeping at night. It's an injectable therapy we have, has GABA, tryptophan, a lot of different things in it. So I would take that to help me sleep. Titan Complete, that's basically our version of a 1 a day, times 10. It's like a multivitamin thing with B12. I actually did that in the office not too long ago. So there's a lot of different things besides testosterone for just gonna make you look and feel better.
What I try to do, and which Titan Medical is great about, and the amazing world we're in with peptides right now, I'm trying to stay preventative and ahead of connective tissue. So whatever peptides they have for any kind of connective tissue, I'm trying to take care of the skin, because it doesn't matter, as you age, things kind of lower. You should always make sure your testosterone is healthy. And then for me, which is cool, that you can learn to read your blood work. Am I overtraining? Because it's the funniest thing is that you think you're doing everything right, and then something pops up, which I think is good. It doesn't matter if you're overtraining your cholesterol or something, but you're always looking for something that you can get better at. And that's for me what my goal is. Each time I do it, it's like, okay, where am I getting good? What's going on? How can I maintain this career that I'm doing right now?
Just the minute you say peptides, the two that really dawn on me immediately that has been a game changer for a lot of patients is your BPC 157 and your TB 500. Like those two, particularly the BPC 157. I mean, the healing peptide for people that have had like, injury in their knee or their elbow or tendonitis, or say they have a shoulder issue, having something to heal it without going to something that might hurt you, like say, let's say oxandrolone or something that is a less effect on the system. You can take it directly. Other peptides out there, as far as like AOD, that's been great for people that want to lose weight, usually people that want to lose 10 or 15 pounds. The huge peptides are your, new one that just came out is your testosterone. That one is really cool because, it helps raise your IGF-1 levels, like CJC, ipamorelin. Semirelin was around before the ipamorelin. They kind of just evolve over the years. But this particular one, I found interesting because it's the only one, Semirelin was, but one of the peptides that's FDA approved. So it's FDA approved, meaning that in order to get FDA approved, you have to do the clinical studies behind it. So you know that the clinical studies have been done on this particular drug. So whatever they're saying it's gonna do, it should do. So you got a lot of different peptides. I mean, they just keep coming, honestly. All different kinds of peptides out there, just for weight loss, for sleep, for healing, just anti-aging properties. There's so many different things.
Everybody in the audience will know somebody that, my gosh, last week they were feeling healthy, and now today they just found out about something. And it's like, blood work can help you jump so much light years ahead of that. PSA for guys, stay on top of that.
So not all blood tests are created the same, right? When you go to a general practitioner, they usually test a couple basic tests. One's like a CMP, it's a comprehensive metabolic panel that really looks at like kidneys, liver, electrolytes. And then they look at a CBC, which is a complete blood cell count. And with that, it usually looks at what they're looking for in there is white blood cell count, and that could say if there's an infection or non-infection or something going on. Red blood cell count, hemoglobin, hematocrit. Those are the big ones to really look at. And then they might run a cholesterol panel on you. So your total cholesterol, triglycerides, LDL, which is your bad cholesterol, HDL, which is your good cholesterol, and the ratio of that. And that's pretty much the gist of what you get from a general practitioner, depending on what your age you're at, because they're supposed to be testing some certain things at like 40, 45, like PSAs and stuff like that. Some don't, some do. So that's generally what they run. And then when you come to Titan Medical Center, our first in-depth panel without any add-ons, you're gonna get the CMP, so you're gonna get the exact same comprehensive metabolic panel that general practitioner would run, a CBC, complete blood cell count. We're gonna run a full cholesterol panel on you, just like they are. We're gonna run a full thyroid panel on you, so we're gonna look at TSH, which is your thyroid stimulating hormone, T3 and T4. We're gonna look, if you're a guy, at your PSA. We're then gonna look at free and total testosterone ranges, estradiol ranges, progesterone ranges, IGF-1 ranges, which is growth hormone, and B12 ranges. That's just in our general in-depth panel, first off. Now we can add on more things if there's more issues. If you're highly stressed, we can add on a cortisol panel. If you're having problems or flare-ups on the nipple or whatever it may be, prolactin could be in there. We could run a full amino acid profile panel on you. So your non-essentials and your essentials. Seeing if, one, if you're lacking, two, if the supplementation you're having or the food you're eating is getting you what you really need. Food sensitivity allergy testing, see if the foods are affecting you in any different way, shape, or form, and a lot more. Like even glutathione. We can test this through the blood to see where your levels are at. And it differs so much from a general practitioner panel that you're gonna get, even to some of the clinics out there. They do the bare minimum to get somebody on TRT or HRT. So they only run a free and total testosterone, a CMP, and that's it. And they're like, man, like, I got a full in-depth blood panel from this clinic. I'm like, what'd you get? And they tell me, I'm like, that's not a full in-depth blood panel. I'm like, this is what we run. And like, wow, this is a lot more testing.
And that's where I thought Titan Medical or T levels or all of this, when we can wrap it up with this whole concept, is that you're helping the average person stay healthy and you're not making them extreme, because I never liked the extreme. Be healthy, be in the right range, make sure that your body's functioning as much as you're trying to live life.